Today I'm joined by Dr. Mukta Sachdev. She is a global KOL. She works in clinical research in cosmetic, and her specialty is in dermatology and skin of color. Today she's joined me to talk about all things radiofrequency. And we're definitely not going to be focusing on one particular device or one particular brand, but rather we wanted to zoom out and just kind of get a broad perspective of radiofrequency in the marketplace. So Dr. Mukta, thank you so much for joining me today. I'd love to dive into radiofrequency, what your experience is. I know you do a lot of clinical studies on radiofrequency. Tell me a little bit about what your experience in aesthetics and working with lasers and radiofrequency has been over your career.
So we've used different devices across a period of 30 years now. I've been using lasers for a long time, energy-based devices. I think the current trend is non-ablative radiofrequency or microneedling radiofrequency. These are well-accepted treatments in the marketplace currently. We have a lot of experience for darker skins because, as you know, radiofrequency is colorblind. So that's a huge advantage for me because I treat darker skin.
Explain for somebody that doesn't know about radiofrequency and how it works in the skin. Tell me a little bit more about why that's a good option for a skin of color patient.
So you are not really burning the skin, but you are inducing new collagen, new elastin, and you're inducing what we call tissue remodeling. So with radiofrequency in today's market, we're looking at a multimodal approach or a multi-level approach where I can work on the superficial layers of the skin, the deeper dermis, and I can induce some really good changes to revitalize the skin.
And what do those changes mean for a patient? What does that look like for a patient?
So clinically, what you would see is that there will be an improvement in fine lines and wrinkles. There will be an improvement in texture, in size of pores. We are seeing that radiofrequency also works on pigmentation. But you'll definitely see a lift in the skin and an overall rejuvenation or revitalization.
That's a really interesting finding. I've not heard of radiofrequency having any kind of effect on pigmentation. And to your point, it's actually a technology that you use for skin of color because it's low risk for causing adverse event as it relates to pigmentation. So how is it, do you think, that we're seeing improvements in pigmentation with radiofrequency?
So I think because we are seeing a tightening of the skin and I think an overall smoothening of the texture, a barrier repair, a barrier strengthening, we know that pigmentation has many different etiologies. It's not just about melanin. It's about barrier, it's about VEGF factors, it's about, many other retinoid pathways and Wnt pathways, signaling pathways. So we're looking at numerous different etiologies for pigmentation. We know that radiofrequency works at several different levels. So I think there may be some merit in exploring this further as an additional benefit to the treatment.
I've also heard that some of the clinical data is showing that you have increased moisturization or hydration in the tissue. Is that your finding as well?
Yes, we did see that. I think that warrants further exploration. I think we are currently doing a study where we're actually measuring using a corneometer or moisture map, and we're using instrumentation to really see the benefits in hydration.
That's very interesting.
Obviously, when you combine these treatments with topicals or adjuvant therapy, you're going to get even better results. And that opens up a whole new armamentarium of treatments.
Yeah, combination therapy is a really big thing these days. So what are your favorite combinations that with non-invasive radiofrequency?
So I usually combine the non-ablative radiofrequencies with topicals. I wouldn't do two treatments on the same session. Let's say I wouldn't combine a Q-switch laser and a radiofrequency together, but I would combine a topical peptide or a topical neurocosmetic, and I would definitely use that on the same session. If I was doing microneedling radiofrequency, then I've opened up channels. So I'd use topical treatment, and that enhances my transdermal penetration of actives.
Tell me a little bit about comfortability. Does that affect what you use on your patients? And if so, like, what does that conversation look like with patients?
So if we're talking about how comfortable the treatment is or how painful the treatment is, a non-ablative radiofrequency is one of the most comfortable treatments today. There's no anesthesia required, quick, easy, painless. And a lot of the devices have inbuilt cooling, which enhances the comfort levels of the patient.
What does the patient journey look like for a patient receiving a non-invasive radiofrequency treatment?
So in our practice, we recommend one treatment every 4 to 6 months. They'll do a treatment, we see a sustained improvement. I think it peaks at about 90 days based on the clinical data we have. And that benefit will persist for 180 days. So we recommend to the patients that you do it twice a year.
How do you know how long a treatment result lasts?
So obviously these kind of results vary individually. It depends on your BMR, it depends on your lifestyle, it depends on many other factors: diet, smoking, alcohol, sunlight exposure, just epigenetics of aging. But on average, 2 to 3 times a year is what will give you the best results.
Tell me a little bit more about the epigenetics about aging. You know, you just did a talk here at ASLMS and in Savannah, and you mentioned that in your talk. Tell me a little bit more about that.
So I think epigenetics and biohacking is the buzzword today. Everybody wants to know what is preventative healthcare? What is longevity looking like? And that is a combination of preventative aging. You have to put in I think you have to put the patients on a journey. You need to give them a blueprint. Where do they start? What treatments need to be integrated? What topicals do they need to use? How often should they do a treatment every year? And patients are looking for that routine or regimen that they can follow. And that's a journey with their dermatologist. And it needs to be explained clearly to ensure best practice and best results.
Does that journey for a young person look similar to that of an older patient that comes into your office?
No, definitely not. I think if it's a younger patient, the focus is more on topical skincare, topical retinoids, preventative use of sunscreen. As one gets older, we introduce devices. You're also looking at maintaining or lifting. So I think probably if I had to say what age would a patient start at, possibly around 28 to 30 is when they would probably come in. That varies. Skin of color doesn't age like a Caucasian skin, so it will vary depending on where one practices.
Do you do non-invasive radiofrequency on patients that don't actually have manifestations of aging, just as a preventative type of measure?
I think, again, I would look at the patient's lifestyle, and it's very individual and customized. I really need to see what that patient's looking for. I often ask the patients to bring in family pictures. Sometimes we like to see the grandma's picture, the mother's picture, and then really see what their journey is going to look like. And that really helps me.
What's your favorite thing about radiofrequency?
I think the ease and comfort of the treatment. I think there's no downtime, patients are happy, and you can see an immediate result. We did a treatment on a patient recently, and they came in and said, all my friends say I'm looking snatched. And we just laughed, because they just said, I'm looking snatched. And it was immediate. She was going out and she just rang us the next day and said I was looking fantastic.
That's wonderful.
It was really, really impressive.
Now let's talk a little bit about the conversation that's been happening, I think, in this whole aesthetic realm for a little bit of time, and it's around the depth of treatment.
Yeah.
I often get asked, how deep does radiofrequency work? Tell me a little bit about your thoughts about depth of treatment as it relates to radiofrequency, non-invasive radiofrequency.
No, I don't think that there's any problems with the non-invasive radiofrequency. I think it is also that you have to look at the patient's structure. If they have no supporting fat, or if there is a very gaunt face, then they may not be ideal candidates, because you don't want them looking, you don't want to make a patient look hollow or gaunt, and therefore you have to choose your treatment correctly. I think we're referring to the atrophy, which is implied with radiofrequency. Non-ablative doesn't cause any atrophy.
Now, how exactly does non-invasive radiofrequency work in the tissue? How does it achieve a clinical endpoint?
So what we're seeing is that there is a fibroblast activation, there is a stimulation of collagen, and there's new collagen and elastin formation, which is triggered by the treatments.
Is there anybody you wouldn't treat with non-invasive radiofrequency?
I think you have to look at certain medical conditions, you have to look at implants, pacemakers. There are contraindications to the treatment per se.
How much do you feel that outcomes depend on the provider versus the technology itself?
Well, I think it's both. I think the provider is super important. You need to be trained, you need to be experienced, you need to know what you're doing. The devices have to deliver what they say they're going to deliver. If the energy is mentioned, I need to know or trust that I'm getting that energy. So that comes with the integrity of the device provider that you work with.
So speaking of device specifics, the buying world as a provider can be very overwhelming, especially for somebody that's new to aesthetics.
Right.
There are so many different technologies. There's so many different specifications for each of the technologies. Tell me about what's important to you when you're looking at a non-invasive radiofrequency device for your practice.
So first of all, when I work with skin of color, I look at safety, I look at the use of the device, I look at the distributor, I look at the manufacturer, I look at everything. Cost is a huge factor, especially when you're new to the laser world. You need to know that you're not going to be in debt and have a device just lying in the corner of your practice. So I think you really need to analyze what kind of practice you have and whether that technology fits into your practice.
How do you measure success of that device in the practice?
I think patient satisfaction, how often repeat visits for the patient. I have some devices where the patient says, I will not do that again, it was too painful. But when you see that patients like the results, it's comfortable, it has to be cost effective, it's a mixture of everything. And I think every treatment is very personal. It's an individual, personal treatment for that patient. So there's no one-stop recipe cookbook or that I can say this works for everybody. It is something that you have to look at your patient and decide what their journey is going to be with you.
If I walk into your practice today and I start telling you about my skin or my issue that I would like to see improved, what exactly does that conversation sound like where you say non-invasive radiofrequency is the tool for you?
So first and foremost, I think the first thing I've learned in medical practice is that you need to be an aggressive listener. You may come in and say that my neck is bothering me, and I may be looking at your frown lines or pigmentation. So I think it's key that I understand what is bothering you and then recommend based on your concern, not my perception. A lot of the time then the patients will ask, what else do you think I need? And then I'm happy to suggest. It's also about using AI or using imaging systems. Take the patient's photograph, show them their image, let them see what they look like, have a detailed discussion, and then it's equally important to show them after the treatment another picture. And sometimes we have patients who are just shocked. They come in and they say there's no improvement. And then when you show them the photograph, they're like, wow, this is great. I want to keep doing this.
I couldn't agree more. That photography is so important.
It is very important for every single treatment and every single visit.
So not only are there a lot of non-invasive radiofrequency devices out there that claim to offer the same benefits, but there are also a lot of different technologies out there. So for example, we have high-intensity focused ultrasound or HIFU. We have lasers that also claim tightening and help with wrinkles and rhytids. And then there's the non-invasive RF category. Some of these technologies target different layers of the skin to achieve similar types of results. Tell me a little bit about how you see the different technologies and where they're placed for what types of clinical endpoints you're looking for.
Right, so the devices I'm currently using are targeting the epidermis, the upper dermis, and the lower dermis. So when you look at targeting those layers, you can see that when you have a multimodal or a multi-level approach, you're going to get a much, much better effect. If you go deeper to the SMAS layer or the muscle layer, that is more for deeper rejuvenation or deeper tightening, and I find that more effective in the older or mature skins and people who have a lot of volume loss or loose skin or saggy skin. So I think you have to look at what level you're looking at targeting, depending again on what your patient needs and what is their concern.
How do you look at specifications like RF type? So for example, the density system is a monopolar and bipolar system. There's a lot of non-invasive devices out there that are monopolar only, and then there are some that are bipolar only. Tell me a little bit more about sequential pulsing.
So because of the research I've been doing and because now I have an innate knowledge of these different levels, we know that sequential pulsing or the combination of monopolar and bipolar is far more effective. So I have been doing this kind of research for a while now. We've been doing studies and we're seeing that this combination definitely is superior.
Do you use radiofrequency microneedling and non-invasive RF?
I do. I use both of them, but not in the same session. And I think the indications I use are slightly different. For example, I prefer using radiofrequency microneedling more with patients who have scarring or a lot of uneven texture versus non-invasive radiofrequency, which is more for lifting, tightening, superficial texture. If you're looking at things like targeting the pores, those are things that I would use the non-invasive treatment for. One thing I'd like to add, though, here is it's very important to keep in mind costs of treatment, what you recommend. It's a whole consideration that, you know, everybody can't afford multiple sessions. So you need to choose what you're doing very carefully for that patient.
Do you ever give the patient the option?
Sometimes patients come back and say, I can't afford this treatment, what else could you offer? And I think that they're quite open about that. And I think we need to be cognizant of that fact. So if they do have a cost concern, we would recommend an alternative treatment.
Now, I know that some of your study work has to do with treatments other than outside of just jawline and lower face. Tell me a little bit more about what types of other areas of the body that you're treating and studying.
So we've been doing some work for body tightening, and as I said that this is such a concern for the Indian or Asian woman that they're looking at tightening on certain areas, especially the arms, the abdomen. So body tightening is one area. The second is eye rejuvenation, periorbital rejuvenation. Now this is a really tricky area to treat, and if you're looking at a non-surgical periorbital rejuvenation. Now, the study we've done has been incredible. We've seen very interesting results. I'm looking at this to be a game changer in practice, that we can offer something where the patient can come in, get their eyes treated, 2 to 3 weeks later, combine it with maybe an injectable toxin, maybe a peel or an under eye mask, and I think we've got a great combination as a non-surgical eye rejuvenation treatment.
Are you using intraocular shields for those
Absolutely.
treatments?
I work closely with an ophthalmologist, and they're luckily available in our office so that the ophthalmologist just slides in the shield. We do our treatment. It's comfortable for the patient, no anesthesia. You need to be really careful when you're dealing with the eyes because sometimes even putting in that shield can scratch the cornea, and that's most uncomfortable for the patient. So it needs to be done expertly.
I hear a lot of patients coming into practices complaining about crepiness of the neck. Do you treat the neck with non-invasive radiofrequency?
Absolutely. This has also been a very, very useful indication because earlier I didn't have too much. Either we use injectable biomodulators, but even that doesn't take away some of the looseness. So I've seen some really nice results with the non-ablative radiofrequency for the neck. There are certain other very interesting indications, for example, abdominal stretch marks. I think rejuvenation of the hands is a big concern. So there are many other potential indications for this non-ablative treatments. People don't want injectables. They don't want invasive anymore. And I think we're seeing a shift in the patient demographic, the patient requirement. They just come in saying, what can you do for me? But I don't want an injection. Anything but an injection. And that's a rider that we see very often in today's practice.
Yeah, I've seen a trend with that as well, also with regenerative medicine and patients coming in asking for more natural types of treatments. Would you consider non-invasive radiofrequency a natural treatment?
I definitely would, because I think the results are very, very natural. They're not they're not aggressive results, or they're not distorting results. They're just enhancing or rejuvenating. So I think they're very, very nice results. And nobody wants to look artificial. Nobody wants to look filled. Nobody wants to have pillow faces anymore. You know, those days are gone. So I think we're in a new era of non-ablative treatments, and we're doing intelligent devices. We are using intelligent devices. We're able to select exactly what layer I want to go to, how much energy I want to give. And that's when you say provider, that's where the expertise comes in. That's why you need to go to someone who really knows what they're doing. And I think companies are training doctors, they're making sure, so minimizing complications.
Oftentimes in this space, you hear that more is more energy, more dose, more time, time on tissue. Tell me a little bit about what your perspective is of high energy or high dose treatments with non-invasive radiofrequency.
So in the beginning, I told you that non-ablative is colorblind. Radiofrequency is colorblind. That does not mean that it cannot burn. So you cannot use high energies on darker skins. And it's definitely less is more. It's not more is more. There's a very fine line, and you transition that line, you're going to burn the patient. And once you have a burn, you're dealing with a whole load of fallout. Patient dissatisfaction, post-inflammatory hyperpigmentation, post-inflammatory hypopigmentation. It's a terrible thing for the patient and for the physician.
So we've talked a lot of technical specifications that probably resonate with a clinician who might be listening. Tell me about how you position a non-invasive radiofrequency treatment to a patient. If I were one of your patients, how do you explain what it is?
So I tell them that this is a treatment that will enhance, it will rejuvenate, and it will keep you looking like you're looking now, and possibly 5 years younger with repeated treatments.
Sign me up. So radiofrequency over the years has evolved quite a bit. We've been using it for decades. And I know early on we used to have monopolar only systems that were very painful. And then we also have tripolar, bipolar. There's all sorts of different things that you can look at. Tell me about what's important to you as far as specifications on a device and why you choose that type of radiofrequency.
So I think patient comfort plus efficacy. I don't want them being comfortable and me not delivering results. So I think it's about an understanding of the science. What level am I going to? What does monopolar versus bipolar mean? And now that we know that there have been studies which have compared monopolar, they're comparing bipolar and sequential monopolar and bipolar. And the evidence points to the combination. So now that I, as a physician, understand this and I know that the combination works better and it's efficacious and it's not super painful for my patient, of course I would choose that. So I think there are devices which have everything. It's about educating the physician to make the correct choice for the patient.
So I'm brand new to aesthetics. I don't know anything about monopolar or bipolar. Tell me in a few sentences what the difference is.
So I think when you combine a monopolar and a bipolar, you are achieving a multimodal or multi-level benefit. Monopolar works deeper, bipolar works superficial in lay terms. Therefore, I'm able to treat the lower levels of the dermis and the upper levels of the skin. If I can treat both of those levels at the same time, I'm going to get a better result.
That makes sense. So you also hear about technologies treating the very deep layers.
Yes.
And I've learned that there's not as much collagen in the deep layers as there is in the superficial or the papillary and reticular dermis. What are your findings as it relates to that?
So when you're treating a deeper layer, you're actually working on the SMARS or the muscle layer, and that has a different benefit. You're looking at a different level of tightening. So I would suggest that if we're looking at treating the younger patients or the middle-aged patients or people who are in their 40s or 50s, the monopolar bipolar combination works brilliantly.
Dr. Mukta, thank you so much for spending some time with me today talking about radio frequency.
Thank you very much. It was my pleasure.